Today we're going to talk about EKG topic, that's how to calculate heart rate. So this is really very important, but nowadays because of the growing technology, the machines itself counts what you call measures the heart rate. But guys, this has to be confirmed by what you call looking at the by yourself, counting the what you call. There's a one simple method by which you can calculate the heart rate, and that is going to be a standard, right, guys? So you know very well the heart rate is really very important. We have two types. One is whether it's a bradycardia or a tachycardia. If it's less than 60, it's going to be brady. If it's more than 100, it's going to be tachycardia, right? So there are plenty of causes for that, number of physiological causes, like pathological causes. So that's why we measure the heart rate. So you know the basic rule, the heart rate. When we talk measuring the heart rate, it usually means the ventricular rate. So if this is a heart, okay, if this is heart, we try to, whenever we talk about the heart rate, we mean the ventricular rate, especially the left ventricle, okay? And this left ventricular rate, what you call it, corresponds to the patient's pulse. Means if the patient's pulse is 80, then heart rate would be 80 only, right? So this is what the basic thing, right, guys? So now on EKG, the depolarization of the ventricles, you know very well what is the effect, what is the wave that it produces if there is a depolarization of the ventricles. Tell me, that's the basic question. That's nothing but if there is a ventricular depolarization, which wave or what is the event that is formed on EKG strip. Tell me, it's nothing but it's what you call QRS complex. QRS complex, it's a ventricular depolarization, then there is a formation of QRS complex on EKG, right, guys? So this is really very important. I'm talking about, you know, the P wave is due to atrial depolarization, right? Like this PR interval, you know, start of atrial depolarization to the start of ventricular depolarization. QRS complex is nothing but it indicates a ventricular depolarization. Why we are taking QRS complex? Because ventricular depolarization indicates the ventricular rate, and that indicates the patient's pulse and the patient's heart rate. That's why we are catching this, right? So before measuring a heart rate through the QRS complex, through the use of the QRS complexes, what you have to do is you have to check whether what you call the paper speed and the what you call the caliber, are they standard or not. What is the caliber speed of the paper should be? Is it going to be 25 millimeter per second? Remember, it's going to be 25 millimeter per second, okay? All right, guys. Then you have what you call you know, the 10 millimeter equals 1 millivolt, and these are the two standard calibers for a standard EKG reading, right, guys? So now let's talk about the what you call how to calculate the heart rate based on a QRS complexes. So what you have to do to calculate the heart rate, okay, you have to count the number of large squares between the two QRS complexes. Okay, you can take it from R to R interval, R to R wave. Okay, so if for example if the between the two QRS complex, for example, if this is a P Q R S T P Q R S and T, okay, if this is, these are the, we have a small squares, we have large squares, right? So try to measure the squares, number of squares. Try to take the R wave, that is what is coinciding with the start of this box, okay, the large box, okay, and to the end of the large box. So it will be very easy for you to count. So for example, if the patient has what you call 5 large squares between two what you call QRS complexes, then heart rate can be calculated as, there is standard formula, 300 divided by 5, okay, 300 divided by 5, so it's gonna be 60 beats per minute, okay. whereas phi is what you call number of large squares between the two QRS complexes. I'm talking about the large squares, remember, not the smaller one. And each large, I think there will be 5 small squares, right? So we're going to take about large squares. Okay, so this is how we calculate the what you call heart rate to the QRS complex. But guys, this depends if the patient has normal heart rate or normal rhythm. Means for each what you call a QRS to QRS distance, only 5 or exactly 5 boxes are there, then it's good. But if the rhythm is changed, sometimes 3, sometimes 2, sometimes 1, sometimes 6, so this formula doesn't work for that. Okay, this formula doesn't work. So what we take a large number of large squares. Means instead of what you call between two waves, between two QRS complexes, we count the number of QRS complexes in a 30 large squares. Okay, in a 30 large squares. If the rhythm is not irregular, okay, if the rhythm is irregular, then we take what you call 30 large squares. This is what you call the number of QRS complexes in 6 seconds. Remember, this indicates number of QRS complexes in the 6 seconds. So for example, let me talk about with an example. Okay, number of QRS complexes in the 30 squares, okay, is number of QRS complexes. Totally we have what you call in a 30 squares is 11, for example. Okay, if it's 11, so therefore the number of QRS complexes in seconds, if you calculate in seconds, okay, as we said, the 30 large squares coincides with the 6 seconds, so it's gonna be same, right? 11 only, right guys? Okay, therefore the number of complexes in a minute to multiply by 10, 6 seconds is multiplied by, if 6 seconds is multiplied by 10, is going to be 1 minute, right? So 1 minute, so 11 squares, what you call QRS complexes into 10 is going to be 110, so it's going to be 110 beats per minute. This is how you calculate the heart rate on EKG. This is really a tachycardia, right guys? So this is how you have to calculate what you call heart rate on EKG. If the rhythm is normal, go ahead with the distance between the two QRS complexes and count the number of large boxes. 300 divided by number of large boxes. 300 divided by number of large boxes. And if its rhythm is irregular, then you have to calculate the QRS complexes in 30 large squares. Okay, and 30 large squares, and depending on that, calculate and multiply, and that indicates particular number of QRS complexes in 6 seconds. Multiply by 10, it's gonna give you the heart rate. Okay guys, so thank you so much for watching this video. I'm sure this video was really very helpful for you to how to calculate the heart rate. Please thumb up the video, share the video, and subscribe. Thank you so much for watching this video. Take care.